What's going on, guys? Today's video is going to be on headaches and the role that exercise can play in either treatment or kind of long-term prevention and alleviation of symptoms. In the video today, we're going to touch on three different types of headaches and kind of the different treatment styles that I've been exposed to here at school, some additional kind of on my own learning, and just general curiosity around the topic, and then some kind of cool research as well. So, the three types of headaches that we're going to kind of touch on today, and we'll kind of break it down as far as the role of exercise and how it can help to either treat or in the prevention and hopefully long term alleviation of severity of symptoms for one of them. The three types that we're going to talk about, the first one is going to be cervicogenic. So, cervicogenic basically just means that there is an issue with the joint motion, specifically in the cervical spine, which will cause a referral type pain pattern that is generally predictable, and you can, through assessment, be very confident in what the correct style of treatment for that type of headache is. Now, when I'm talking about like joint motion, specifically the cervicogenic headache is most commonly issues with kind of that upper cervical, so the couple vertebral segments at kind of the top of your spine and then kind of the base of the skull, how those all interact together. The reason why we talk about the joint, uh, either from a motion standpoint or just like what the role of inside the joint capsule is going on, is the mechanoreceptors that are being affected are there to detect stretch, detect pressure, and detect movement. For whatever reason, this style of headache, there has been loss of proper movement or too much movement in one way that has kind of irritated these mechanoreceptors. Now, with that, there's a few different ways how to approach treatment. So, since it is a movement issue that has caused the symptoms, it can also be treated with movement. Um, Before I get into that, as far as like where that pain might be coming from and that style of headache, that'd be basically just like at the base of the skull and then kind of down into maybe the top portion of the neck. Um, Generally, it's going to be unilateral, but you could have like a radiating type effect where it could feel that it's going on both sides, but more than likely it's going to be more tender on one side than the other. A couple different ways how to treat that. So, already talked about the movement has been the problem child, I guess is a way to say it, in the reason why the symptoms have came up. So movement can be also the thing that kind of comes in to save the day. So a couple ways to affect movement of those mechanoreceptors and the joints is, first off, I'm going to chiropractic school, so we're learning how to adjust upper cervically. That is an amazing tool at this style of headache, and that is why so many people see chiropractors for headache relief. Specifically, this kind of headache is extremely affected by an upper cervical adjustment. Now, there's other ways that maybe um, aren't as invasive as an upper cervical adjustment, or just are a lot more general than um, the specific intervention of a chiropractic adjustment. So another thing that has really good research to support it would be the McKenzie method. So basically, just like repeated movement and repeated movement testing, just getting motion into those joints can help kind of calm down those mechanoreceptors. And that would be usually from like, I've had too much movement in one direction, so I kind of need to treat movement in the opposite direction, kind of a balancing effect of, in that method, would be finding somebody's directional preference and then helping to treat the symptoms by giving them more of that directional preference movement. Another style of headache that this is kind of a personal one that I've dealt with, and I, you know, before you start kind of learning and investigating stuff on your own, you kind of just think all headaches are the same. You may have heard some things from people who have experienced, I guess, more severity or more regularity in their headaches, and you start to put some things together. But another joint in the skull that can create headache type symptoms and a referral pattern that is best described as like a tension style of headache would be from the TMJ. So what that tension style headache distribution pattern looks like is it basically run along both sides of the head, kind of just along the eyes here, and then it might drape bilaterally down into the base of the skull. So some crossover there from the cervicogenic headache, so you can see how you can get very easily confused. Now, the TMJ joint is your jaw joint. This can get irritated for a bunch of different reasons. Now, that joint, whether you're chewing, talking, whatever, uh, it gets a lot of motion. So there is a very high density of mechanoreceptors for that reason. It needs to have good joint proprioception. So when it gets pissed off, basically, it can become very irritated and it can create this like headache referral type pattern. Now, it can be coming from the joint. It can also be coming kind of from the muscles that surround the joint. So people who are very, high stress, and they might not even realize that they're doing it, or they do realize that they're doing it. Maybe they notice it during their sleep, but they are kind of like clenching their jaw repeatedly. That's called bruxing of your jaw. It has its own term, but that just creates the muscles that help the jaw move. They can get very tight, and that can also um, lead to that kind of headache referral pattern. So tightness in the muscle, tightness around the joint, they kind of all have an interplay together. Now, treatment of that becomes a little bit different. So that's a joint that gets a lot of movement. So there is kind of a conscious side of it where it's if you're somebody who's constantly clenching, maybe when you get stressed or things of that nature, just bringing a little bit more awareness to that and trying not to clench as much as you can. There's a kind of a whole analysis when it comes to that, but just a general recommendation of trying to bring a little bit more awareness to, hey, if I feel myself getting stressed and I feel like I'm really kind of bearing down on, you can feel the tightness in those muscles. Try to just relax the jaw, not create so much tonicity in those muscles there that are going to be affecting the joint. From like a self kind of treatment or self assessment, basically, if I ever have this style of headache or I feel it kind of coming on, which for me it is usually associated with times of stress. Basically, you can come right off the bottom of your ear here, so the earlobe, just kind of come in right to where the jaw softens, and this would be like one of those muscles. And you can just do a little kind of self massage in like a circular pattern. Another thing kind of cool in my own self research would be, so the resting position, if you feel that that kind of headache is coming on, would basically be um, lips together, teeth apart, and tongue on the roof of the mouth. It kind of sounds silly, but it puts that jaw musculature in a resting position. Personally, I've actually seen pretty good result with that when I am in a really high stress situation. So that's another thing other than just bringing more awareness of how often we are maybe creating tension through the jaw and then leading to those symptoms. And then lastly, a unfortunately very common type of headache as well, and those who suffer from it know that it can be very debilitating and very intense, would be the migraine. So migraine headaches are of the two style of headaches and referral patterns that we've talked about, the migraine would be the most severe so far. Um, Generally, migraines are associated with a throbbing and very painful experience. Light sensitivity is common, but not required to have the diagnosis of a migraine. And then, if the other two things were kind of grouped in, the movement makes it better, or like movement awareness makes it better. Generally, movement while you are having a migraine episode will make it worse. So that's a typical common experience of somebody who has a migraine. They might describe it as, I feel this trigger kind of coming on. I can almost pre-sense that I know that I'm going to be having that migraine. And then the migraine hits, and it's described as, I lay in a dark room, I try not to move, I try to find a position where I can tolerate the level of pain that I'm in, and I just try to wait it out a little bit. Maybe there's some anecdotal, somewhat individual ways that people deal with migraines, but I guess our best understanding of them is there is more of a neurological and vascular component to them that, based off my understanding, we are still trying to better understand how to treat migraines, because there is some variability within people's migraine experience and what we understand the process of how that might come on for people. Now, that doesn't mean that if you have a migraine, there's no solution for you, because people who have migraines, they, go on to live their day-to-day lives just fine. However, often people who have migraines, that does mean there's going to be some sort of pharmacological intervention. Those can be effective, and if you need it, use it. But I've actually found that, and it was kind of just by happenstance, but came across a cool research article, and it talked about the number one non-pharmacological recommendation for people to decrease their severity and regularity of migraine headaches is regular aerobic exercise. So that kind of ties into how there is a vascular component to the style of headache, to the migraine, to that style of headache. So regular exercise can be a preventative and then hopefully a reductionary type activity for those struggling with migraines, which is great, because regular aerobic exercise, you have lots of different ways how to access that, whether that be, running, biking, just doing something to get your heart rate up, trying to do it on a somewhat regular basis. If you're somebody who suffers with migraine, that is the number one recommended non-pharmacological intervention. This is just kind of a more clinical video, but it's something that I'm starting to get asked a little bit more as far as, being a chiropractor. People walk into a chiropractor's office often for headaches. So this is just kind of a little insight into my mind as far as how I'm trying to balance an assessment to figure out what's the right type of treatment. And then from my last video, some of those exercises are really great at kind of treating specifically the first style of headache that I mentioned, the cervicogenic. But it's hard to do the full TMJ assessment in a video as well. So, till next time.